this is actually the reason for squint eye, because the muscles have become very strong and this will not help in the easy movement of the eyeball. So what the physician is going to do, he is either going to do a procedure called as a recession surgery or a resection surgery. So what happens is, when I say recession, it is a muscle weakening procedure. So for squint and strabismus, you need to know the doctor will definitely perform a recession or a resection surgery so that the strength of that particular muscle will be reduced. He is going to resect a part of this lateral rectus muscle so that it does not have an accentuating influence upon the globe. Here we have different code sets for strabismus surgery depending on the muscles that are being treated. Perhaps a doctor is going to treat like 3 different muscles, say a superior oblique, a medial rectus and a lateral rectus. You need to select a code, repair of strabismus surgery for the number of muscles that are being involved. But you should understand, a superior oblique has a separate code. So you will have to report a code for horizontal, and again you should also report a code for superior oblique muscle separately. In addition, along with this strabismus surgery, you are supposed to report the other add-on codes. For example, if posterior fixation technique is done, that means the physician will go and fix the muscle tendon more posteriorly, or if he is doing like giving like adjustable sutures, you need to report that separately. Plus, if the same person has undergone any eye treatment prior within a short period of time, that means as a secondary procedure they are doing this strabismus surgery, you should also report the add-on codes appropriately. So for strabismus surgery, you should know the number of muscles that are involved, number of muscles that are being treated, whether tarsal, levator, mullar, resection, depending on the type of muscles that are being treated, whether it is internal approach or external approach, and you'll have to see the add-on codes for like posterior fixation or any adjustable sutures, or the patient has underwent any prior surgical procedure.